Right, so. Right. Let's do this. Welcome to another episode of Round the Table, and today we're going to be answering your most asked questions on the CH5 chair. So this is questions we get asked regularly on demos and ward visits and emails and online. So I guess let's hit the first question. So, can the CH5 be used outside?
Yes, it absolutely can, Jasper. So it's got very strong casters, so it can be wheeled outside as long as it's not on gravel or grass, but with a normal hospital setting of tarmac, block paving, no problem at all. It's also got a battery backup on there, so it can be used away from the power, and we've got some pictures that won't we, Jasper?
Yep.
You can see that.
As you can probably see here, or wherever the editors put it, and the chair was used actually at Royal Oldham's ICU unit, and they used it outside for a patient there to do karaoke. So I guess it helps people get better at singing. Right.
Put smiles on their faces.
He does look like he's happy, so definitely put smiles on people's faces. So question 2 is, does the CH5 integrate with the Sara Stedy and other standing aids and hoist as well? What's the answer to that?
Yes, it does. This is a good question. We actually, when we designed the chair, we designed it around the different standing aids. So it integrates really well with pretty much every aid. I don't think we've come across an aid yet that it doesn't integrate well with. We worked with the Sara Stedy originally, but then we kept the base all open, so hoist can go in from any angle.
And you can see a video of that here, and also we'll put a link in the description to a video we did of that, where we used 3 or 4 hoists and we used it on the chair. They work perfectly fine. So another question we get asked regularly is, can the chair be put into a Trendelenburg position?
It can. It goes to 25 degrees of tilt and can go flat, and so you can get Trendelenburg on it.
Okay, that's good, that is. One question they do like to know a lot is, how long can the patients be sat in the chair for?
So, with the standard setup, with the standard cushion that comes with the chair, which is a very high risk gel cushion, patients can sit on there for 4 to 6 hours, but it depends on the patient. But also, with our chair, you can spec it however you want. So some hospitals have had different cushions on there, and in that situation it would be probably different, but we'd have to work on each scenario
individual case. The question 5, so this is most relevant to those who have got a Sertain or have looked at the Sertain in the past, and people would like to know, is the CH5 seat a bit smaller than the Sertain? So I guess give them the answer.
So it's an interesting one because it looks like it is, but as soon as you get a tape measure, it's not. So it's the same seat width, same seat depth, but the footprint of the whole chair itself is smaller. So we've achieved that just by having a leg rest tucked underneath. Backrest goes slightly more upright. The armrests are very slightly thinner, just to make it that smaller footprint.
Yeah, one thing we do hear a bit is hospitals often say that it's the only chair you don't have to open 2 doors to get it through. So also,
correct.
didn't we hear once that it was the only chair, I think it was on a trial, that was the only chair that people didn't have to stand to the side when going down a corridor, on a small corridor. So yeah, it's got a smaller footprint, I guess, but the seat width is not changed.
Yeah.
So question 6 is, can the lateral supports be changed to wings post-purchase? And that does work the other way, so can the wings be changed to laterals post-purchase? But what's the verdict?
So it is technically possible, but it would be at a cost due to the fact that the wings are properly fixed in with brackets that are hard bolted in. So we can do it, but it would be at a cost.
Okay. Obviously, it works with standing aids, but can the chair itself help patients stand? And then the other question we commonly get is, can the chair tilt forward to help people stand?
So it doesn't tilt forward. It's like a rise recliner, but it can help patients stand. So like I mentioned before about the leg rest tucking underneath the chair, if a patient shuffles to the front of the chair with their heels right back and then you raise the height, it's a much more natural stand position than a rise recliner, which is why we didn't do it. But yes, you can help a patient stand off the chair.
So another question we get asked is, does the CH5 chair go into a tilt table?
So, interesting question. We actually get asked this a lot. So CH5 chair doesn't, but we do a chair that can go to a tilt table, so it lies flat and tilts. What we find though is we don't recommend it unless you really need to, and it's something you've used before. Just for a chair to lie flat and then tilt, it has to have a really high seat height to allow it, so it doesn't hit the floor, as you can imagine. And also they are bulky and heavy and very expensive. So it works if someone wants a chair that lies flat and goes to a tilt table. We'd always recommend that you buy a tilt table and a lay flat chair, separate things, as that actually works out cheaper than one chair that does both. And also then you can treat two patients at the same time.
Okay.
But yeah, I don't know if that helps.
That's good. So we'll end on question 9 for this episode, but next episode we'll finish off the questions, got a few more. So that's it for episode 2. On the next episode we will actually be answering the rest of the questions we get asked, the common questions. If you've got any, feel free to put them in the comments or send them to us direct and we'll answer them too. But thank you very much, and we look forward to seeing you on the next one.